हॅलो स्टुडंट्स, वेलकम बॅक टू माय चॅनल @said by Sayali. जसं मी सांगितलं होतं की लेक्चर नंतर आपले सॉल्व्ड MCQचा एक व्हिडिओ येणार आहे. तर आज आपण 30+ सॉल्व्ड MCQ बघणार आहे ऑन ब्लड पार्ट 1, म्हणजे जे आपण फॉर्मेशन, ब्लड कंपोजिशन वगैरे बघितलेलं त्यावर. आणि नेक्स्ट ब्लड पार्ट 2चे MCQज नेक्स्ट फ्रायडेला येतील. तर MCQ आणि क्वेश्चन असणार स्लाइड 1 वर, स्लाइड 2 वर त्याचं एक्सप्लेनेशन असणार. तर लगेच लगेच स्लाइड 1 2 असं पटपट बघत जाऊ नका. पहिल्यांदा जेव्हा मी क्वेश्चन रीड करेल तेव्हा तुम्ही पण विचार करायचा आहे आणि त्या चार मधलं कोणतं आन्सर असू शकतं हे आधी नोट डाऊन करायचं. असे 30 MCQचं नोट डाऊन करायचं आणि नंतर टिक मार्क करायचं की राईट आलं की रॉंग आलं. त्याच्यावरून आपल्याला समजणार आहे की किती स्टडी झाला. फक्त ब्लाइंडली व्हिडिओ बघत जायचं नाहीये, MCQ बघत जायचं नाही. असे मग तुम्ही 1000 जरी MCQ बघितले तरीही तुम्हाला समजणार नाही की कसे क्वेश्चन्स येतील किंवा कसे सॉल्व्ह करायचे. ओके, चलो लेट गेट स्टार्टेड. तो चलो, क्वेश्चन नंबर 1. What percentage of a blood volume is present in plasma? A is 25, B is 45, C 55 and D 65%. ज्यांनी ज्यांनी लेक्चर अटेंड केलेलं असणार आहे त्यांना या क्वेश्चनचे आन्सर इझिली सॉल्व्ह करता येणार आहे. देन द करेक्ट आन्सर इज C 55%. द blood composition is plasma plus formed elements. Plasma is of 55% and formed elements of 45%. And in plasma, mostly there is water, then proteins, hormones, waste products. And in formed elements, 45%, majorly RBCs, WBCs, and platelets. What is the importance? The plasma, what is the role of plasma? Is transport the nutrients, gases, hormones, and maintains the blood pressure and volume. Question number 2. Which plasma protein maintains a oncotic pressure of blood? A is globulin, B albumin, C fibrinogen, and D hemoglobin. The correct answer is B albumin. Albumin, 60% of plasma protein. It regulates the oncotic pressure. Now, what is oncotic pressure? It prevents a fluid leakage into the tissue. There is a fluid around our tissues, and the albumin plays a role to leakage of the tissues, prevents the fluid leakage, prevent the fluid to enter in our tissue. It is the role of albumin, which is the 60% of plasma protein, which prevents a edema. What is the role of a globulin? Is a transport and production of antibodies. What is the role of fibrinogen? It is a clotting protein and converted to the fibrin. The clinical relevance, if albumin level gets low, then it can causes edema seen in liver disease, malnutrition and nephrotic syndrome. आता जिथे जिथे क्लिनिकल रिलेव्हन्स असणार आहे त्याचा अर्थ असा आहे की जे काही आपलं आन्सर आहे, फॉर एक्झाम्पल अल्ब्युमिन, तर ते कमी झालं जास्त झालं तर कोणते डिसिजेस होऊ शकतात, कोणत्या कंडिशन्स असू शकतात, असं आहे क्लिनिकल रिलेव्हन्स. तर चलो, क्वेश्चन नंबर 3. ॲव्हरेज लाईफ स्पॅन ऑफ आरबीसी इन द सर्क्युलेशन इज A 60%, B 90%, C 120%, and D 150%. Most easy question. Then the correct answer is C 120%. First thing, RBC get formed, RBC formation, erythropoiesis in a blood, a bone marrow, stimulated by erythropoietic from a kidney. Then second, there is a 120 days of lifespan of RBCs. RBC is a biconcave, concave, non-nucleated and cell-specialized oxygen transport. And then RBC get destructed. RBC get formed, then its lifespan is 120 days, and then RBC destruction occurs in a spleen, which is called as graveyard of RBCs. RBCs get destroyed there. Clinical relevance is reduced RBC survival cause the hemolytic anemia. Question 4. In adults, the hematopoiesis occurs mainly in which organ? A. Liver, B. Spleen, C. Red bone marrow, and D. Lymph nodes. Then what is the correct answer? C. Red bone marrow. The fetal hematopoiesis occurs in a yolk sac, liver and spleen, and then bone marrow. Adult hematopoiesis causing red bone marrow, flat bones like a sternum, pelvis, ribs, and vertebrae. The bone marrow is a pluripotent hematopoietic stem cells which then differentiate into the all blood cells. The clinical, the bone marrow biopsy diagnosis of leukemia or anemia. Bone marrow biopsy करतात जेव्हा ल्युकेमिया आणि अॅनिमियाचं डायग्नोसिस करायचं असेल तेव्हा. Question number 5. Normal hemoglobin level in adult males 8 to 10 gram per deciliter, 12 to 14, 13 to 17, 18 to 20. Then the correct answer is for male, it is a 13 to 17. See here, 13 to 17 for a man and 12 to 15 for a woman. बेसिक क्वेश्चनचे आन्सर्स आपल्याला यायला पाहिजेत. हे तर डे टू डे लाईफ मध्ये पण आपण बघतो, घरी रिपोर्ट्स आले की किती असू शकतं आन्सर. Hemoglobin structure and function. Now we know hemoglobin composed of heme plus globin protein chains. Heme composed of iron plus protoporphyrin. The function of hemoglobin is the transport of oxygen and CO2. If hemoglobin level get reduced, then it causes the condition called as anemia. And if the hemoglobin level increases, it is a very rare condition, polycythemia. Now, question number 6. The oxygen binds to which part of a hemoglobin? A. Globin chain. B. Iron in heme. C. Carboxyl group and D. Platelet factor. जर काही स्टुडंट्स पोस्ट चे वरचे MCQ जर सॉल्व्ह करत असतील, मी टाकत असते पोट्स आपल्या युट्यूब चॅनलवर, तर त्यांना याचा आन्सर येत असणार आहे, कारण हा क्वेश्चन तिथे टाकला होता मी. Then the correct answer is iron in heme, Fe2+. Each Hb molecule has a 4 heme groups. Ferrous ions binds O2 reversibly, then oxyhemoglobin. If F2 oxidized to Fe3, then methemoglobin cannot carry O2. Clinical resemblance carbon monoxide poisoning. CO binds Hb more strongly than O2. Then it is a carboxyhemoglobin hypoxia. Heme should get bind with the oxygen, not with the carbon dioxide. If it get binds with the carbon dioxide, it can cause carbon monoxide, then it can cause carbon monoxide poisoning. CO should not bind with the Hb more strongly than O2 oxygen. It can synthesize carboxyhemoglobin, which is not good. It can cause hypoxia. Clear? Then question number 7. Which WBC is most abundant in a normal blood? A. Lymphocytes, B. Monocytes, C. Neutrophils and D. Eosinophils. जसं मी लेक्चरमध्ये तो ग्राफ काढून दिलेला, चार्ट ड्रॉ करून दिलेला, तसा चार्ट लक्षात ठेवायचा आहे, तसा चार्ट बुकमध्ये काढायचा आहे. ह्याच्यात कधीच प्रॉब्लेम येणार नाही किती पर्सेंटेज WBC आहे, RBC आहे, प्लेटलेट्स आहे, आणि त्याच्यामध्ये पण कोणतं सर्वात जास्त अमाऊंटमध्ये आहे. Then the right answer is C. Neutrophils. You can see here Neutrophils present 60 to 70%, lymphocytes present 20 to 25, monocyte present 3 to 8%, eosinophils present 2 to 4%, and basophils present 1%. If the neutrophils quantity increases, then it is due to the bacterial infection. If the lymphocyte quantity increases, then you are having a viral infection. And if the quantity of eosinophil increases, you are having any allergy in the body. So correct answer is neutrophil. Question number 8. The platelets are derived from which precursor? A. Monocytes, B. Karyocytes, C. Neutrophils, and D. Stem cells. Platelets are derived from the which precursor? We have seen that. What is the answer? The correct answer is megakaryocytes. The platelet cytoplastic fragments of megakaryocytes in a bone marrow. The lifespan is of 7 to 10 days. It counts 1.5 to 4.5 lakh per microliter. The function of megakaryocytes is clotting, release clotting factor, wound healing. If clinical resemblance, if platelets decreases, it can cause a thrombocytopenia, bleeding tendency in body, internal body. Platelet count increases, then thrombocytosis, thrombosis risk. Clear? Question number 9. Hematopoietic stem cells are unipotent, pluripotent, totipotent, terminally differentiate. Hematopoietic stem cells. Correct answer is B. Pluripotent. The hematopoietic stem cells are pluripotent. That means they can form all blood cells like RBCs, WBCs, and platelets. A topipotent means they can only form all embryonic plus extra embryonic tissues. Unipotent is only one type of cell type is formed by it. Clinically, the bone marrow transplantation restores the hematopoiesis in leukemia and aplastic anemia. What was the question? Hematopoietic stem cells are pluripotent because they manufacture or they form both RBCs, WBCs, and platelets. Simple questions are there because we have already seen it is related to the blood only. Normal total leukocyte WBC count in adult. What is the normal total leukocyte count in adult? A is 1000 to 3000 per microliter, B 4000 to 11,000, C 15,000 to 20,000, and D 15,000 to 1 lakh. Then the correct answer is B 4000 to 11,000 per microliter. Normal total leukocyte count in adult is B 1000 to 11,000 per microliter. The normal WBC count, leukocyte should be less than 11,000. In leukopenia, it should less than 4,000, that is HIV, bone marrow failure, drugs like chemotherapy. Clinical significance, TLC and DLC are routine blood test parameters for checking WBC count. Next question. Normal RBC count in adult male is A 2 to 3 million per microliter, 3 to 4 million, 4.5 to 6 million, and 7 to 8 million. Then the correct answer is 4.5 to 6 million per microliter. That is C. Normal RBC count in adult male is 4.5 to 6 million per microliter. For adult woman, it is slightly lower. It is typically between 4 to 5.5 million per microliter. These cells are crucial for oxygen and carbon dioxide transport via hemoglobin. Clinically, decrease in RBC count can indicate the anemic condition, while an elevated count may suggest a polycythemia, both requiring further investigations. So, RBC should not be in a high amount or should not be in a low amount for a male and female. Specific criteria is there. Question number 12. Which of the following is not granulocyte? You should read a question twice. First just read, then get understand and then again read. पटपट क्वेश्चंस वाचायचे आणि पटपट सॉल्व करायचे नाही. टेक अ few seconds to read a question. See how I am reading. Which of the following is not a granulocyte? म्हणजे यामधले कोणतं ग्रॅन्युलोसाइट नाहीये. ग्रॅन्युलोसाइट आहे नाहीये. मोस्ट ऑफ द टाइम वी फॉरगॉट टू रीड नॉट and then our answer is wrong. आपल्याला येत असूनही आपलं आन्सर चुकतं, which is called as silly mistakes. So A is neutrophil, B is basophil, C is lymphocyte and D is eosinophil. Then the correct answer is lymphocyte, which is not a granulocyte, lymphocyte. Which blood cells are broadly categorized into the granulocyte and agranulocyte? Granulocytes are neutrophils, eosinophils and basophils, and agranulocytes are lymphocytes and monocytes. So two types, granulocytes and agranulocytes. Granulocytes is containing granules in their cytoplasm. Agranulocytes are lacking a prominent granules. Granulocytes are neutrophils, eosinophil, basophil. Agranulocytes are lymphocytes and monocytes. So not विचारलंय तर जे बाकीचे आहेत A, B आणि D, they are granulocytes. Only the lymphocyte is a granulocyte. So correct answer is lymphocyte. Question number 13. Which electrolyte is most abundant in plasma? कोणतं इलेक्ट्रोलाइट अबंडंट फॉर्म अमाउंट मध्ये प्रेझेंट आहे प्लाझ्मा मध्ये? A is sodium, B is potassium, C is calcium and D is magnesium. Then the correct answer is sodium. The plasma electrolyte, see here, Na plus, that is sodium, is 135 to 145. Potassium 3.5 to 5 and calcium 8.5 to 10.5 mg per dl. So सर्वात जास्त काय प्रेझेंट आहे? सोडियम, मोस्ट अबंडंट कटायन. Clinically, if hyponatremia occurs, it leads to the seizures and weakness. कमी amount of hypo means low. कमी amount of sodium present असेल तर इट कॅन कॉज विकनेस अँड सीझर्स. म्हणूनच आपल्याला विकनेस वगैरे असेल तर आपण इलेक्ट्रोलाइट्स घेतो. सिंपल आहे. यू शुड कोरिलेट विथ युअर डे टू डे लाईफ. यू विल गेट द आन्सर्स ऑफ द क्वेश्चन. नॉट सो मच हार्ड क्वेश्चन्स आर देअर रिलेटेड टू द ब्लड. Question number 14. Which vitamin is essential for a hemoglobin synthesis? Now, A. Vitamin A, B. Vitamin B12, C. Vitamin C, D. Vitamin D. Then the correct answer is B. Vitamin B12. The hemoglobin synthesis, a vital process of oxygen transport, relies heavily on several key nutrients. While the iron is direct component of the heme group, vitamin B12 and a folic acid are indispensable for the DNA synthesis required for a red blood cell production. So, the essential vitamin for a hemoglobin synthesis is vitamin B12. Now question number 15. Which are the largest white blood cells in the circulation? White blood cells म्हणजे काय? WBCs. Which are the largest white blood cells in a circulation? A. Neutrophil, B. Monocyte, C. Lymphocytes and D. Basophils. Now comment which is the correct answer before I am going to the next slide. बी मोनोसाइट्स. ज्यांचं ज्यांचं करेक्ट आलंय त्यांनी मला कमेंट करा खाली की मॅडम आम्ही करेक्ट आन्सर देतोय स्लाइडचं आन्सर आणि एक्सप्लेनेशन समजण्याच्या आधीच. Largest white blood cells in a circulation is monocyte. The largest white blood cell in a circulation ranging from 12 to 20. तर हा पण क्वेश्चन येऊ शकतो की what is the diameter of a monocyte? Then the diameter is 12 to 20 micrometer. They are critical players in an immune system primarily known for their role as a precursors to the macrophages. Next question, question number 16. Carbon dioxide transport in a blood is done mainly by dissolved CO2 in plasma, carbanohemoglobin, bicarbonate ions bound to the plasma protein. Important question. Carbon dioxide transport in a blood is mainly by bicarbonate ions. 70% by bicarbonate ions, 20 to 25% by carbanohemoglobin, and 5 to 7% dissolved CO2 in plasma. The body effectively transports carbon dioxide, a metabolic waste product, in three primary forms. The majority of CO2 is transported as a bicarbonate ions, a crucial mechanism for maintaining a blood pH. A smaller portion binds to the hemoglobin as a carbanohemoglobin, and an ever smaller amount remain dissolved in plasma. The disruptions in these transport mechanism can significantly impact acid-base balance in the body, and it will lead to the condition like respiratory acidosis or alkalosis. Clear? Question was carbon dioxide transport in a blood is mainly done by bicarbonate ions, then carbanohemoglobin, and then remaining amount get dissolved in plasma. Clear? Question number 17. Which enzyme in RBC converts CO2 into the HCO3? A. Carbonic anhydrase, B. Catalase, C. Peroxidase, and D. Dihydrogenase. Then the correct answer is A. Carbonic anhydrase. The rapid conversion of carbon dioxide to the bicarbonate ions within the red blood cells is facilitated by enzyme carbonic anhydrase. This enzyme catalyst is a reversible reactions. CO2 plus H2O give H2CO3, then it gives H plus HCO3 minus. It is reversible that it will H2CO3 will get converted in CO2 plus H2O. It is reversible reaction. There are two types: irreversible reaction, reversible reaction. Question number 18. Erythropoietin is secreted mainly by A. liver, B. kidney, C. spleen, and D. bone marrow. Erythropoietin. लक्षात ठेवायचे काय विचारलंय आणि कशाचा आन्सर देतं. दोनदा रीड करायचं. इरेथ्रोपोएटिन इन अ इज secreted mainly by liver, kidney, spleen, bone marrow. Then the correct answer is kidney. मेनली विचारलंय. तिन्हीमध्ये पण थोडं थोडं अमाऊंटमध्ये होणार, पण सर्वात जास्त कुठे होतंय? किडनीमध्ये. The primary site of EOP production responding directly to the hypoxia. Liver 10% contributes a smaller but a still significant amount of EOP, particularly in a fetal life. Bone marrow, the target of EOP where the red blood cell production is stimulated. Erythropoietin is a hormone crucial for RBC production, regulating RBC production. Its secretion is primarily by kidney, then liver, and then bone marrow. In clinical practice, the recombinant EPO is a vital treatment for anemia associated with the chronic kidney diseases where the natural EPO production is deficient. Erythropoietin is secreted mainly by kidney, then liver, and then bone marrow. Clear? Question number 19. The normal platelet count is 50,000 to 10,000 per microliter, 1 to 1.5 lakh, 1.5 to 4.5 lakh, and 5 to 10 lakh. आता हे नंबर्स आहेत ना व्हॅरी होऊ शकतात. खूप व्हॅरी नाही होत, पण त्याच्या आपल्याला जवळपासची रेंज बघायची असते. सो हे नोट डाऊन करून ठेवा याच्या रेंजेस आणि मग हे त्याच्या जवळपास आपण आन्सर करायचे, कारण एक्झॅक्ट अमाऊंट आपल्याला दिलेली नसते. कधी कधी थोडं वरखाली पण असतात. सो अशा एक्झॅक्ट 1.5 lakh असंच एक्झाममध्ये येईल असं नाही. सो सिमिलर त्याच्या रेंजेस आपल्याला माहिती पाहिजे. The normal platelet count, the correct answer is 1.5 to 4.5 lakh per microliter. If the count below 1 lakh per microliter, it indicates a bleeding risk, while those below in 20,000 can lead to the spontaneous bleeding. Conversely, elevated platelet counts may increase the risk of thrombosis. प्लेटलेट काउंट 1 लाखापेक्षा कमी झाला तर त्याच्यामध्ये ब्लिडिंग रिस्क असू शकते, आणि जर 20,000 पेक्षा सुद्धा कमी झाला तर इट कॅन कॉज अ स्पॉन्टेनियस ब्लिडिंग, अँड देन इफ इलिव्हेटेड देन इट कॅन कॉज द रिस्क ऑफ thrombosis condition. Clear? Question number 20. The function of basophils is mainly phagocytosis, histamine and heparin release, C. antibody production, D. antigen presentation. Then the correct answer is B. histamine and heparin release. आपण लेक्चर मध्ये हे घेतलेलं. Function of basophil is histamine and heparin release. The basophil, though constituting less than 1% in WBC, that is 0.5%, are key players in allergic reaction and inflammatory responses. They release histamine, vasodilator, and heparin, an anticoagulant. Their function is similar to mast cells found in tissues, and an increase in a basophil can be seen in a condition like chronic myeloid leukemia. Clear? Then the function of basophil is histamine and heparin release. Question number 22. Which protein transports a copper in plasma? A. Albumin, B. ceruloplasmin, C. Serratin, and D. transferrin. Then what is the correct answer? The correct answer is B. ceruloplasmin. Which protein transport copper in plasma is ceruloplasmin. CC you can remember. C copper, C ceruloplasmin. Ceruloplasmin is primarily protein responsible for transporting copper within the plasma. This protein also plays a critical role as an oxidase enzyme, converting the ferrous ion to ferric ion, that is Fe2 plus to Fe3 plus, a form that can then bind to the transferrin for transport. The clinical significance is low levels of a ceruloplasmin are a hallmark of Wilson's disease. If the cellular plasmin level it gets reduced, it leads to the disease called Wilson's disease, which is a genetic disorder characterized by the excessive copper accumulation in the body, particularly in liver and brain. Protein transport copper in plasma is ceruloplasmin. Next question is hyperbilirubinemia leads to A. Pallor, B. Cyanosis, C. Jaundice and D. Edema. The correct answer is C. Jaundice. Jaundice तर माहिती आहे सगळ्यांना. It is a yellow sign of excessive bilirubin in the body. Hyperbilirubinemia refers to the elevated levels of bilirubin in blood, which is a yellow pigment formed from the breakdown of heme, primarily from the old red blood cells. When a bilirubin levels become excessively high, it deposits in a tissue and leading a yellowish discoloration of the skin, the mucous membrane and a sclera, whites of the eyes, a condition called as jaundice. Jaundice can be classified in a based of origin, that is prehepatic due to the increased RBC breakdown, example hemolysis, hepatic due to the liver disease affecting the bilirubin processing, a post-hepatic due to the obstruction of bile flow. Hyperbilirubinemia leads to the jaundice. C. Jaundice. Question number 23. What is the normal blood pH? काय आता नॉर्मल ब्लड पीएच? हे तर खूप सिंपल आहे, हे यायलाच पाहिजे. कमेंट डाऊन पुढे जायच्या आधीच कमेंट करा काय आन्सर असणार आहे नॉर्मल ब्लड पीएच. The correct answer is C, 7.35 to 7.45, which is a slightly alkaline. Maintained by a buffer by carbonates, phosphates, proteins, lungs, kidneys. Acidosis, if the pH get low by 7.35, it is acidosis. And if increases above 7.45, then it is a alkosis. Clear? Next question. Which WBC produces antibodies? Simplest question, you all should answer this. A. Neutrophils, B. Lymphocytes, C. T lymphocytes and D. Monocytes. The correct answer is, comment below, B. Lymphocytes. Lymphocytes, B lymphocyte differentiate into the plasma cells which are primary producers of the antibodies. These antibodies are crucial for a hormonal immunity, targeting species pathogens for a destruction. In contrast, T lymphocytes are involved in a cell-mediated immunity. What is the clinical relevance? The deficiencies in a B lymphocytes functions lead to the humoral immunodeficiencies, which increasing susceptibility to the bacterial infections. जर बीटा लिम्फोसाइट्सचं डिफिशियन्सी झाली तर बॅक्टेरियल इन्फेक्शन्स बॉडीमध्ये वाढू शकतात. Question number 25. Which WBC is first responder in active bacterial infection? आन्सर काय असणार आहे? सर्वात जास्त कोण प्रॉम्प्ट आहे फॉर अ allergic reaction, bacterial infections? A. Neutrophils, B. Monocytes, C. Basophils and D. Lymphocytes. The correct answer is neutrophils. Neutrophils are the most abundant type of a white blood cells and serve as the first line of a defense in active bacterial infections. They'll rapidly migrate to the site of an infection and engulf the pathogen. Engulf म्हणजे swallows करणार ते directly. It will get covered around the pathogen. Phagocytosis. Monocytes differentiate into the macrophages which are important in a chronic infections, while lymphocytes are crucial for a viral defense. Clear? The question was the first responder in acute bacterial infection is neutrophils. Question number 6. Which is the smallest formed element in the blood? Neutrophils, platelets, RBCs and lymphocytes. काय असणार आहे? B. Platelets. Platelets are indeed the smallest formed elements in the blood, typically measuring 2 to 4 micrometer in a diameter. The RBCs are significantly larger and amount to 7.5 micrometer. लक्षात ठेवायचं हे. And white blood cells are even larger than RBCs. Platelets are crucial for initiating blood clotting and wound healing. Question number 27. Myeloblast differentiate into RBCs, granulocytes, lymphocytes and platelets. Now tell me what is the answer? Granulocytes. The myeloblasts are immature cells in the bone marrow that mature into the granulocytes like neutrophils, eosinophils and basophils. These are the key components of an innate immune system. In the contrast, the lymphoblasts differentiate into the lymphocytes, then megakaryoblast give rise to the platelets, which are essential for hemostasis. What was the question? Myeloblasts differentiate into the granulocytes. Clear? Question number 28. Normal ESR in males is. What is ESR? Comment the answer. What is ESR in a male? Is 0.5, 10 to 12, 30 to 40, 50 to 60. The correct answer is A, 0 to 5 mm per hour. Erythrocyte sedimentation rate is the right answer for ESR. Is a non-specific test for an inflammation. The normal values vary slightly by a gender and a age. For a man, it is 0 to 15 mm per hour. For women, it is 0 to 20 mm per hour. आता टेस्ट स्पेसिफिक असणारे आणि जेंडर स्पेसिफिक पण असणारे बऱ्याचशा ब्लड रिलेटेड गोष्टी. An elevated ASR suggested ongoing inflammation, infection or a tissue damage. तुम्हाला जर करंटली कोणतं व्हायरल इन्फेक्शन वगैरे होऊन गेलेलं असेल किंवा बॉडीमध्ये काही इन्फ्लामेशन झालेलं असेल, स्वेलिंग आलेली असेल आणि त्याच्यानंतर तुम्ही जर रिपोर्ट्स काढले तर हमखास तुमचं ESR इन्क्रीज झालेलं असतं. While not diagnostic of a specific condition, it is often used to monitor inflammatory diseases like rheumatoid arthritis or tuberculosis. Mostly आपण कोणताही डिसीज डिटेक्ट करण्याच्या आधी ब्लड सॅम्पल्सच घेतो आणि त्याच्यावर वेगवेगळ्या टेस्ट करतो आणि त्याच्यानंतरच आपल्याला डायग्नोस होतं की कोणते डिसीजेस आहेत. सो तसं बघायला गेलं तर ब्लड इज अ इम्पॉर्टंट टॉपिक. हिमॅटोपोएसिस बिफोर बर्थ ऑकर्स इन ॲडल्टमध्ये बघितलं आपण आणि त्याच क्वेश्चनच्या एक्सप्लेनेशनमध्ये पण बघितलंय. हिमॅटोपोएसिस बिफोर बर्थ ऑकर्स इन A. Yolk sac, B. Bone marrow, C. Kidneys and D. Thymus. A. Yolk sac is the correct answer. The fetal blood cell production transitions yolk sac. जे बेबीज अजून बॉर्नच नाही झालेत त्यांच्यामध्ये ते योल्क सॅकमध्ये होणार आहे आणि ॲडल्टमध्ये बोन मॅरोमध्ये आपलं प्रोडक्शन होणार आहे. दिस सिक्वेन्शियल शिफ्ट एन्श्युअर द कंटिन्युअल ब्लड सेल सप्लाय थ्रू आउट द डेव्हलपमेंट. Question number 13. Which gas binds irreversibly to the hemoglobin? Oxygen, carbon dioxide, nitric oxide and carbon monoxide. आधीच्या एका क्वेश्चनच्या एक्सप्लेनेशन मध्ये आपण बघितलंय विच गॅस बाइंड्स इरिव्हर्सिबली टू द हेमोग्लोबिन. द करेक्ट आन्सर इज डी कार्बन मोनॉक्साईड. आणि आपण टॉक्झिसिटी पण होऊ शकते ह्याचं, कार्बन मोनॉक्साईड पॉइझनिंग होऊ शकतं हे सुद्धा बघितलंय. फक्त सरसकट बघत जायचं नाहीये व्हिडिओ, नोट डाऊन करत जायचंय. नोट डाऊन केलं आणि नीट लक्ष दिलं तर समजणार आहे, नाहीतर व्हिडिओ 10-15 वेळा बघितला तरी इथे काहीच जाणार नाही. Carbon monoxide has an affinity for a hemoglobin that is 200 to 250 times greater than oxygen. जसं आपलं वाईट गोष्टीकडे जास्त ॲफिनिटी असते तसंच सेम कार्बन मोनॉक्साईड हॅज ॲफिनिटी फॉर अ हिमोग्लोबिन. मग कार्बन मोनॉक्साईड आपण कसं चुकीच्या गोष्टी लवकर अडॅप्ट करतो, सेम चुकीचं कोणती गोष्ट आपल्याला लवकर अडॅप्ट होते तसंच कार्बन मोनॉक्साईड लवकर ॲफिनेट होणार हिमोग्लोबिन ॲज कम्पेअर टू ऑक्सिजन. ऑक्सिजन चांगलं आहे. The strong binding forms a carboxy hemoglobin which effectively reduces oxygen carrying capacity of blood, which leads to the cellular hypoxia. The clinical implications: patient present with the cherry red skin due to the COHB but are profound the hypoxic at a tissue level. The treatment involves immediate administration of 100% of oxygen or a hyperbaric oxygen therapy to displace CO from hemoglobin. Clear? Now, question number 31. What percentage of the human body is blood by weight? वेटनी किती ब्लड आहे आपल्या बॉडीमध्ये? A 3-4%, 5-6%, 7-8%, and D 10%. The correct answer is 7-8% blood by weight present in the body, and in volume बघितलं तर 70 to 80 ml per kg body weight. For a 70 kg man, there is a 5 to 6 liter of blood is present in body. This forms a 7 to 8% of total body weight. Male has slightly more blood than female. The key point you should remember that 7 to 8% body weight equals to blood volume. Question number 32. Which blood cells are anucleate in a humans? ह्या क्वेश्चनचा आन्सर तर यायलाच पाहिजे. A neutrophils, B platelets, C RBCs, and D lymphocytes. Correct answer is C RBCs. Which bloods are anucleate? C RBCs. Human RBCs lose anucleate during maturation. More room for a hemoglobin, which increases the CO2 carrying capacity. Platelets are not a whole cells but fragments of a megakaryocytes. So technically also a nucleate. The answer is RBCs, mainly a nucleate cells. इथे आपले क्वेश्चन संपलेले आहेत. तर स्टुडंट्स, हा व्हिडिओ आवडलाय, हेल्पफुल वाटलाय तर लाईक करा, शेअर करा तुमच्या फ्रेंड्स सोबत आणि सबस्क्राईब करा चॅनलला अशाच नवीन MCQ सॉल्व्ह MCQs व्हिडिओसाठी. आणि मला कमेंट करा की लेक्चर सेपरेट आणि MCQ सेपरेट हवे आहेत की MCQच हवे आहेत आणि त्याचं एक्सप्लेनेशन इन डिटेल पाहिजे आहे. 2 ऑप्शन आहेत तुमच्याकडे. एक तर आपण लेक्चर वेगळे बनवू आणि MCQs वेगळे बनवू, नाहीतर आपण MCQs घेऊयात सगळे आणि त्याच्या एक्सप्लेनेशन मध्ये आपण तो टॉपिक कव्हर करूया. तुम्हाला काय चालणार आहे कमेंट बिलो. अँड चलो अभ्यास करा. अभ्यास स्वतःचं रीडिंग झाल्यानंतर MCQs बघा, तुम्हाला सगळं लक्षात येईल. आणि हो, मला कमेंट करा की 90% आन्सर्स कोणाचे राईट होते किंवा किती आन्सर्स तुमचे राईट आले. तर चलो बाय.